Hello, my name is Fiorella Jarrin, and I'm going to talk about cardiac metastasis in melanoma. Definition. Melanoma is a common neoplasm with a propensity to metastasize to the heart. Metastases of the cardiac structure are rare, but 20 to 40 times more common than primary cardiac tumor. Application in nursing. Treat symptoms which include pain, nausea, shortness of breath, insomnia, and other physical problems caused by cancer or its treatment. Ensure that patients and caregivers understand the diagnosis and treatment objectives.
When I was 47 years old, I was diagnosed with stage 4 metastatic melanoma. My symptoms were a black, purple, ugly nodule on the back of my neck. Where it was there, I covered it up with a Band-Aid and tried to put some stuff on it. I actually just didn't want to accept what it, I didn't know what it was, but I knew it wasn't normal. I went to my family doctor. He took one look at it, and he said some words, and I knew it wasn't good. I was at work 7 to 10 days later, and my mom had told me that you got melanoma cancer. I remember my first visit. I was on the 9th floor. It was no longer being used for what it was then. The room was full. I was with my 2 brothers and my nephew. Very nervous. Got the paperwork done, a lot of paper. Probably spent 3 or 4 hours there, and I was officially registered. I went straight to the oncologist, Dr. Who. Surgery on that spot that the doctor cut off. Had 3-hour surgery. The prognosis was very good. Not in my lymph nodes. Everything was good. A type of called interferon. The interferon, I continued 4 months at home, giving my self a shot 2 days a week. I went 4 months, and then I'll never forget it. It was a Saturday morning. I was on my way to work. I had my jacket in the back, and I put the jacket. I knew what was coming. I put the jacket on my lap, and as I'm going down the freeway, I started throwing up. I had tears. I was very upset emotionally as well as sick. And I called my mom. I said, Mom, I can't do it no more. I can't do it. No more interferon. We're done with it. Dr. Who was all for it. He knew I gave it my best shot. Dr. Who was very personal, very knowledgeable. Every time I visited him, we talked about bowling. He always has analogies of what I was going through to like a football game. I remember one time he said, Tim, we're throwing a Hail Mary. And stuff like that. So I can relate to it. We always hit it all. He's one of my best friends.
Pros and cons. Metastatic melanoma involves heart or pericardium in greater than 50% of the cases. Although cardiac metastases are rarely diagnosed and antemortem. Metastatic cardiac melanoma is often clinically silent, and signs and symptoms are typically non-specific. Dyspnea, pedal or edema, cough, tachycardia, arrhythmia, and chest pain. Because of the lack of symptoms, in most of the cases, cardiac metastases are diagnosed post-mortem, but a multimodality approach may help to obtain a more timely diagnosis. In rare cases, cardiac metastasis can be the first manifestation of a tumor of unknown primary origin.
Joseph. I'm a medical oncologist at Mayo Clinic, Jacksonville, Florida. My clinical expertise is in cutaneous malignancies, including melanoma and other skin cancers. And I also treat genitourinary malignancies as well. So melanoma is distinct from other skin cancers in that it is usually a proliferation of pigmented cells, although not always. Melanoma can also originate in different parts of the mucosal tract, including the head and neck, as well as the GI tract, as well as on the bottoms of the palms and soles, which usually doesn't occur in other types of skin cancers. Melanoma is the most deadly form of skin cancer because it is the cancer that is most likely to spread to other organs. Other types of skin cancers rarely spread from outside of the surface of the skin, and the ability of the melanoma to metastasize makes it the most deadly. And the stage 1 melanoma has a cure rate of about 95%. So if you catch it early, that's great. A thicker melanoma, something that is still in the skin but has not spread to the lymph nodes or the rest of the body, still has a pretty high chance of cure of catching it early, somewhere in the range of 70 to 80% chance of cure. Stage 3 melanoma is when the melanoma has escaped from the skin and gone to the lymph nodes. And we divide stage 3 into stage 3A, B, and C, depending on how many lymph nodes are involved. And the cure rate there drops all the way down as low as 20%. Many lymph nodes are involved, and as high as 60 to 70%. Only one lymph node is involved. Stage 4 melanoma is a melanoma that has left the lymph nodes and gone to distant parts of the body. And there, the survival is much less. The overall average median survival is, we're talking in the order of months to maybe a year or so. However, those numbers are getting better with I see melanoma patients usually at 2 phases. The first phase is if they are diagnosed and they have a lymph node that is positive. Traditionally, the lymph node is removed by the surgeon, and then they come to see me to help them prevent the melanoma from recurring in the rest of their body. And at Mayo Clinic, we have several clinical studies that are geared towards preventing melanoma from spreading to the rest of the body, which we call stage 4 melanoma rather than stage 3. Melanoma does predominantly exist in the older population. However, the amount of number in the younger population is much higher than other types of cancer. We still have a long way to go to eradicate melanoma or completely cure the majority of the patients. But before the last 5 years, we were talking about getting responses and helping maybe 5 to 10% of patients. Now we're moving that bar up to anywhere to 20 to 50% of patients, of causing them long-term remissions, which is a huge step forward, but obviously leaves us with another 50% to improve on as well. So long way to go, but we've come a long way.
Issues of light in Ecuador. Of these, only 1% are melanoma, the most dangerous type of skin cancer, and responsible for 90% of death from the disease. The main strategy to avoid its appearance is to avoid excessive exposure to the sun. However, the OMS warns that the global incidence of the disease does not stop growing. Conclusion: people with fair skin and light eyes, redheads, people who burn easily, those with a family history of skin cancer or melanoma, and people who are long in the sun are at greater risk, so they should visit the dermatologist frequently to check moles.
We're going to look at melanoma. This is an overview of melanoma, an introduction. Melanoma is cancer of the skin. Melanoma has the highest mortality rate of all dermatological cancers. It's also one of the most common cancers in young adults. What are some risk factors for developing melanoma? Some Common risk factors include having a family history of melanoma, having a personal history, having light hair color, light eye color, having a high freckle density, being immunosuppressed either because of the use of drugs or having a particular disease, and having multiple melanocytic nevi, essentially multiple moles. How does melanoma look like? Well, melanoma looks different in each individual. Let's zoom into this person's face. And here's a cross-section of the skin with melanoma. Let us compare this to a normal skin cross-section. The top layer of our skin is known as the epidermis. Below the epidermis is the layer called the dermis. The dermis is another layer known as the hypodermis, which contains subcutaneous fat, which is important for thermoregulation. As I mentioned, melanoma is different in each individual. However, melanoma is usually always pigmented. It's a pigmented lesion. It's often asymmetric. It has ill-defined borders, and melanoma often bleeds or ulcerates. How does melanoma develop? Let us zoom into the epidermal layer of the normal skin and compare it to the epidermal layer of a skin with melanoma. We're now looking at the pathology of melanoma. So here are some cells that make up the epidermis. Here again is our epidermal layer, and below the epidermis is our dermis. In between the epidermis and the dermis is our basement membrane. Essentially, this is what separates the epidermis to the dermis. Above the basement membrane, we have a special cell of the skin known as melanocyte. Melanocytes are important for us because they help protect us from UV radiation, and they help in our skin pigmentation. Melanoma, what happens is we have proliferating melanocytes. So these melanocytes that are normally harmless become mutated, and they grow and divide rapidly, resulting in melanoma. Risk factors can lead to these proliferating melanocytes. Going to a doctor and is suspected of having melanoma, it is important to examine the skin lesion. A good way to examine the skin lesion is to follow the A, B, C, D, E rule. So in A, we look for asymmetry. In B, we look for ill-defined borders. In C, we look for any color changes or even bleeding. In D, we check for the diameter and possibly the depth. And E, possibly the most important, is we look at elevation and in particular evolution. So if the skin lesion changes quickly or rapidly in short duration, melanoma is suspected. There are ways to prevent melanoma. These include wearing a hat, sunscreen, long-sleeve shirts, protective clothing, especially if you work outside a lot, wearing sunglasses, and also if you have a family or personal history of melanoma, having regular doctor skin checks or even self-skin checks. That was an overview of melanoma. Thank you for watching.